If there is a government shutdown, Dr. Emanuel, can you walk us through, even if it's just in the short term, how that is going to affect health policy and health programs in this country?
Well, about 42% of all the workers at Health and Human Services will be furloughed. That includes about 80% of the people who work at the National Institutes of Health, the NIH. That includes about 60% of the CDC and 20% of the FDA. And that, of course, is going to impact clinical research. It's going to impact the ability to monitor flu and COVID. It's going to impact the FDA's ability to oversee various parts of their mandate, including food safety. So it's going to affect us all. The payments for Medicare for seeing a doctor or going into the hospital are going to continue. But one should, the audience should not be misled. This is a huge distraction. I worked for the federal government during several shutdowns, and the problem is you take time preparing for the shutdown, then the shutdown's over and you've got to reorganize things. And during that shutdown, you can't do any work. Not a single email can you send, not a telephone call. And that leads to a huge backlog of items that you need to attend to. I'll just tell you right now, I'm trying to do some work with Medicare to try to improve how they monitor or assess and pay for patients. And, we're worried we're not going to be able to get data from them to do the analyses that we need because of this shutdown. And that'll put our project well behind and maybe savings for the government well behind. So, it affects everyone.
Yeah, likewise, we in the business news profession will not be getting some of the data that we rely on and that market participants rely on as well, Dr. Emanuel. So it sounds like that this week is really kind of a crazy week for those who are working in these facilities for the government because they're trying to pack all of this in and try to prepare for this.
Yes, they are, anticipating they'll be around for lots of votes. But I will say one thing which I find pretty disturbing. You often hear from Republicans, government should operate more like a business. There's no business that would operate like this. Where the people writing the checks, the chief financial officer would say, oh, we're going on furlough because, we can't pass a budget here, or we can't agree on a budget in the C-suite. That just wouldn't happen. And that's basically what we're having here. And it's a very small minority. I was with a Republican congressman from Ron Johnson's state, Wisconsin, this weekend. And, he was bemoaning his colleagues and the fact that they are trying to, sabotage government and the operations of the government without a plan for what to do. And, this all happens after the Republicans agreed with President Biden on a spending strategy. Well, you agreed on a spending strategy. All the president is asking for is to have that implemented. And, that's an agreed project. Is your word no good? Is legislation that you vote on not valid? It's real tragedy. And again, as I said, if you're working in the government and you're trying to help people in the government, this is a huge distraction from your regular everyday job. And as you point out, it doesn't just affect people getting healthcare from the government. It affects everyone, whether it's data or worrying about housing or worrying about agriculture. It's a big problem that should never happen. We can't even get a defense.
And Dr. Emanuel, just so we're clear, when we talk about the effect and the impact for the audience listening right here, a short-term shutdown, as I understand it, wouldn't impact programs like Medicare and Medicaid. Is that accurate? If the duration is brief?
Well, let's be clear. It wouldn't impact the payment to hospitals, doctors, laboratories, and others. But it will impact their ability to make improvements in the program and to run other projects that they're doing, trying to improve the way Medicare functions. We're constantly saying short term. Even a few days is a huge distraction, and I think people have to appreciate that.
Well, and even some of these people who are going to work with emergency functions aren't getting paid for the duration of the shutdown, which is something that should be noted as well. One of the other things that the government is working on in order to try to reduce its costs, separate from the shutdown, is Medicare and Medicaid price negotiations, which is something new. The government is aggressively recruiting folks to these jobs to try to do this negotiation. As somebody who has tracked healthcare policy, how big a deal is this? And how hard is this going to be? This is a big change.
It is a big change. The government has been prohibited from negotiating drug prices for Medicare since the early 2000s. And it is a major change. Now, the negotiations are going to take a few years. They don't go into effect at 2026, but it takes time to analyze the market, to make sure what a fair price is, to look at what's happening in other countries regarding prices. And the important thing is that this is the start of a process. I would say the other thing that's really important is, we always learn about how programs are working and what their effect is. And one of the important things for a brand new major program like this that's affecting over $500 billion of, basically drug prices is to really understand where we need improvements and changes to that kind of legislation. We should never think of something as important as drug price regulation as one and done. We need to think about it as, well, we're going through the process, we're learning about the process, but we're also learning about what things maybe don't work and need to be reformed. And what I'm afraid of is that, with Congress distracted talking about budgets and talking about lots of other things like, promotions in the Defense Department, which are being held up by a senator from Alabama, that they're not able to focus on, let's make this better. Again, drug price negotiation is something that 80-90% of the American public agrees to, whether they're Republicans or Democrats. It's very popular, and we've got to get it right.
Dr. Zeke Emanuel was so helpful with that insight. We really appreciate your time. You were generous with it.
Thank you. Look forward to talking to you again.